the ongoing pandemic of corona and all other epidemics and pandemics and diseases, etc. Bismillah ar-Rahman ar-Rahim. Our topic today is the introduction to research, and in this topic we will also see that how should we search for the literatures while doing our research, and what is the literature search actually is. So when you tries to think that how should I conduct a research, you should first have to know that what the research actually is. What is research? So if you see the different books and the Wikipedias and the books of research methodology and epidemiology, you may be able to find the different definitions of research, like any creative systemic activity undertaken in order to increase the stock of knowledge, including knowledge of man, culture, and society, and the use of this knowledge to devise new applications. And this is the one definition of the research. And actually, you see, the research word is a combination of two words, the search and re. So research, you search for some knowledge, and as a result of that knowledge, you come across some another questions which has to be solved, and then you research to find out the answer of those questions, and then some other new problems come in front of you, and then research, and search again. This is all the research, the process which is going on since the ancestor timings, but it modified and became systemic as the time passed on. So the another definition of research, if you see, maybe the research is a process of steps used to collect and analyze informations to increase our understanding of a topic or issue. So continuously in different definitions you are looking at, research are the collection of data. Okay, now this collection, different steps to collect this data and to analyze this data, and then to interpret this data. All this is the research, and if these are all systemic, then it is called the research methodology. It consists of three steps. Number one, you first pose a question. You first design a question or find out a question, and then you start collecting data to answer this question, and then present an answer to this question. So first you have to find out the question, you have to pose a question, you have to design and manufacture a question, and then you collect the data to find out the answer of this question, and then give the answer of that question or the solution of that problem. Research is not a new thing, and it is being done from the time beyond history. Evolution of the clinical research traverses a long and fascinating journey, and from the first recorded trial of legumes in biblical times to the first randomized controlled trials of the streptomycin in 1946. This first recorded trial of legumes, which was in the biblical time, near about 2,500 years ago. This was done by a king, and we will see a glance of that. History of medical research covers a wide variety of challenges, and these are the scientific challenges, then the ethical challenges, and then the regulatory challenges. Now you are looking, taking the example of this research of the coronavirus treatment, then you are looking about the scientific evidences that we have very less knowledge of this, and which medicines are effective against this and which are not, and then the treatment by the immunoglobulins, and then by the treatment of the plasma. So what is the science behind all this, and what are the ethical issues of using a plasma or the antibodies of a person who has had suffered through this disease, and then what the regulatory authorities are concerned to it, which persons, who persons are doing it, what is the draft, who will regulate the thing, who will give the ethical approvals and all that. These are the different aspects of research to do. This study of the scurvy that was done in 1747, and this was the trial, the first trial, experimental trial, you say, that was conducted by the James Lin, and that contained the most elements of a controlled trial, which were not randomized. Actually, we will see further on what the difference between a randomized trial and a non-randomized trials is. So this was done. What this James Lin did, that he divided the scurvy patients who were in a ship. He divided them into 6 groups, and then give each group one conventional therapy, which were conventional at that time, and then compared the results of these 6 different types of the therapies, the results of all these therapies, and this became near about very near to the experimental trials of nowadays. Then you can see in 1854, the first epidemiologic research that is being said to be done by the John Snow, that what happened in London, an epidemic of the cholera occurred there, at which in only 10 days take about the life of near about 500 pupils, and nobody was known. Remember that up till that time, the Vibrio cholera organism was not identified, and nobody was acknowledged that why this type of the disease is occurring there. Then there was a man, John Islow, who was an epidemiologist, and what he did, he made a map of the cases that occurred, map according to their address, and then he saw that the majority of the cases are coming from a certain area of that city. Then he tried to find out, that is, what is the difference in between the habitats of this area, residents of this area, as compared to the residents of other area where there are occasional cases. And then he find out that there is one difference in between them, that is the difference of the water supply. The water supply of the residents of this area were different as compared to the residents of those areas from where the very little number of the cases, last number of the cases are coming. And then he interpreted that there is something in this water that is causing the infection. That water source was sealed, and alternative water was provided to that community, and the prevalence of cholera drastically lower down in that area. And it is after that that the Vibrio cholera organism was identified, and the study of the John Snow was being confirmed. In UK, the Medical Research Council, trials of the patulin. This is said to be the first scientific experimental trial in 1943, and they did the first double-blind controlled trials for the treatment of common cold. And double-blind means that if I am giving, I'm making 2 groups of the patients and giving one drug A, to one patient, and drug A, you see, is the conventional drug which was being used from the past times, and to another group I am giving drug B. This drug B is a new medicine which has been invented, and I am comparing the results of the both drugs. So if the patient don't know that whether he is receiving the drug A or drug B, or in other words, the patient don't know that whether he is receiving the old conventional drug or a new therapy, then this is called the single therapy. The patient is blind. He cannot identify. He don't know that which of the drug is has been given to which group. For the group 1 is given the drug A, but the researcher don't know, okay, drug A is the old drug or the new drug. Only the administrators knows that drug A is the old or new. So the researcher is blind himself. So this is done to exclude the bias that whether if I know that drug B is the new drug, and I believe most of the time the researchers and the persons believe that the new drug is more effective as compared to the previous one. So they will try to put their own relatives, their own things to the new groups. So if the researcher is blind by himself, then the bias is being excluded. So this is the double blind. Triple blind is also there, where the analyst, even analysts don't know that which of the drug is the old drug and which drug is the new drug. A is the old or B is the old. And the analyst, after doing all the analysis, can just give the drug B is superior than the drug A. But he cannot say which drug was it. It is burned in the last of the research. So this is what do we mean by the blinding. And this is the single blind, double blind, and the triple blind. So this was the double blind study that was done, that was being administered by the Medical Research Council of United Kingdom. It was done in 1943, and it was done on the patients of the Commonwealth Hospital in London. And one by one we will see qualitative, observational, experimental, basic, applied, and the developmental research. But in fact, if you see, according to me, if you want to see the two broader type, two main type of the research, they are the basic research and the applied research. What do we mean by the basic research? Basic research is the real research where we just work, we just try to find out some new knowledge. And the only difference in between the basic research and applied research is that in the basic research, we just seek the knowledge for the sake of knowledge. And at that time, when we are finding out this new knowledge, we don't know by ourselves that what is the use of this knowledge. This is the real pure research to find out the new knowledge. For example, you see, at the time when a person find out that the earth, the previous belief of the peoples were that earth is a flat like a plate. But then one scientist came there and find it out that the earth is not flat, but it is circular, rounded. Then after some time, another scientist proved it that it is actually not the circular or the rounded, it is something like oval shaped. But see, at the time when that scientist found it out, that earth is not flat, but it is slightly circular or rounded in shape. What was the use of this knowledge at that time? There was no use of this knowledge at the time. However, afterwards, this knowledge became the basics of many geographical, land shipping, and many other, a lot of the things. But at that time, when this knowledge was founded out, seeked out, there was no use of that knowledge. Now see, previously it was believed that the human beings are the most superior species of all in the universe. And as the human beings are living on the earth, so earth is the center of the universe, and everything in the universe is revolving around earth. And it was evident from the eye observation that the moon is revolving around the earth, the sun is revolving around the earth, and the stars are revolving around the earth. They are rising from one side of the earth, and then they are setting on the other side of the earth. But then another scientist came there and he said that this religious belief that the earth is the center of the universe is not true. And earth is not the center of the universe, but rather the universe is being divided into many systems. And this solar system in which we are living, the sun is the center of this solar system. And however, this is true that moon is revolving around the earth, but the earth along with moon is revolving around the sun. The religious peoples came against him, and he was being penalized in the court for the death sentence of death. And he was given an option. Galileo was the scientist that either you drink this bowl of poison, or you deny your statement that Earth is not the center of the universe. And then he denied his statement and said, yes, okay, sun is the center of the universe, and Earth is not revolving around the sun, but the sun is revolving around the Earth. But when after he came out of the court, he said, what the Galileo says doesn't make any difference to Earth or the sun. So this is what the basic research knowledge for the sake of knowledge, to increase the knowledge of the mankind without knowing the use of that knowledge. However, the use of that knowledge may be discovered afterwards in the future. Then there is the applied research. Applied research, the basic difference in between these two, the basic and applied. In the applied research, we know the use of the knowledge that we are going to acquire. Okay, applied research is most of the time done to find out the answer of a question, or to find out the solution of a problem. Okay, for example, I say that the prevalence of diarrhea is more in one community as compared to another community. What is the reason? So this is the question. Now I try to find out the answer of this question, that why the prevalence of diarrhea is more in this community. What are the contributing factors that are contributing towards the increased prevalence of diarrhea in this community? And this is what the applied research is. Then we will see that the quantitative research, and this is what the collection of the objective or the numerator, the quantitative and the qualitative research. If you see that in the qualitative research, we gives open-ended questions, and we try to find out the in-depth knowledge of the person living in the community. Just for example, say that I'm doing a qualitative research of say what is weaning. I'm trying to find out the knowledge, attitude, and practices regarding weaning of different individuals. And I pose a question to the individuals in my questionnaire: what is weaning? Okay. And I pose another question, that with which food you start the weaning. As a result of this question, what is weaning, I gets too many answers regarding the definitions of the weaning. For example, I get 20 or 25 definitions, explanations of the word meaning. And then when I pose a question, with which food you start weaning, again I get a list of 20 or 25 food items. Maybe the saralak, maybe the farex, maybe the khichdi, maybe the banana, and many others. So this is what the qualitative. I am not giving the options, I am not giving the answers of the questions to choose anyone. And this is what the qualitative. I am trying to find out the in-depth knowledge from the community. And then after doing this qualitative research, I took the 5 most common definitions of the weaning that has been given by the community. And in this definition, one definition is the real definition, and another definition which is very near to the true definitions. And then I do a quantitative research. Again, I give the question, what is weaning? But now in the answer option section, I give 5 different options. Okay, 5 definitions of the weaning. And one of that definition is true. And then when I pose a question, with which food you start weaning, I give 5 foods, 5 most common foods that came from my that qualitative research. And I say the replier, the participant, to choose any one of them. So this is the basic difference in between the qualitative research and the quantitative research. And in qualitative research, instead of numbers, this type of research provides information in form of words or visual representation. This is the qualitative. It relies on researchers to observe, record what is happening in the community, what the community think by itself, and such as participants answer to open-ended question. And this is the basic thing. The questions are open-ended, no option has been given. Subjects' behavior or the results of experiments are being recorded, and the case studies are common examples of the qualitative research. And then In the quantitative research, collecting of objective numerical data, and the statistical here, the objective, this is not the subjectives, and I'm giving the options 1, 2, 3, and 4, and the participant has to choose one option, and according to the choice of the participant, I'm giving him a number and then analyzing the things. Statistical models are constructed to analyze and explain the information that has been gathered, and some of the tools used from this type of the research include questionnaires and the equipments. And the goal of the quantitative research is to compile statistical evidence. So the questionnaire used in this method typically include yes or no question or the multiple choice question rather than open-ended question, such as in the qualitative research. Okay. In the qualitative research, we usually use the open-ended questions, and this is the basic difference in between the quantitative and qualitative researches, that in quantitative, researcher tends to remain objectively separated from the subject matter and analyze the numerical data through descriptive or the inferential statistics, while in qualitative, research tends to become subjective. He tries to find out the ideas of the participant immersed in the subject's matter and analyze data such as words, pictures, objects through descriptive coding, indexing, narrations, integrative diagrams, or the thematic analysis. Qualitative research are based on the opinions and experiences. They have the smaller sample size. Interviews focus most of the time. They are done through the interviews, and then the in-depth analysis is being done in the qualitative research, and open-ended questions are being used. While in the quantitative research, rather than the opinions, it is based on the numbers. It may be done in the larger sample size, and usually it is done in online or the postal surveys or the individual surveys or the computer assistant telephonic surveys, etc. And then percentage of the pupils agreed with a statement is being analyzed. Mostly close-ended questions are being used in this type of the research. And there are the different examples of the qualitative and quantitative research. And then there is another type of the research. This is the observational research and then the experimental research. The difference in between observational and experimental research is that in observational research, we usually just observe and do not try to intervene in between the natural occurrence of the things. Okay, we see, for example, see the example of an observational research that I'm doing, a very famous study that the bronchogenic carcinoma is 20 times more in the people who smoke as compared to the people who do not smoke. How this study was being done? This was a cohort study, and it was prospective, looking in forward, taking two groups. One group was exposed and one was not exposed, meaning one group was a smoker exposed to the hazard, one group was non-smoker not exposed to the hazards. And then we observed these two groups in the forward prospectively for next 10 years, and see how many people from the smokers developed bronchogenic carcinoma and how many people from the non-smokers developed bronchogenic carcinoma. And we saw that out of 100 smokers, 80 developed the bronchogenic carcinoma, and out of 100 non-smokers, only 20 developed the bronchogenic carcinoma. This means the incidence of bronchogenic carcinoma is more in the people who smoke as compared to those who do not smoke. Now see, in all this research, we had not intervened in between the natural occurrence of disease. We just observed the thing. This is what the observational research are, and the collection of information without interference or input from the researcher. It is the examination of things as they naturally occur, and the researcher is simply observer. He simply observes, measures, or records what occurs. That information is then analyzed and used to draw the conclusions. Observational studies are non-experimental. Naturally, if we cannot intervene, we cannot do any experiment. Observational, because there is no individual intervention. Treatment and exposures occur in a non-controlled environment. as you are just observing the things, you are not controlling the environment. And individuals can be observed prospectively, retrospectively, or currently. In the future, as I gave the example previously, retrospectively we can observe through the records, or currently we can again observe in the current. In experimental research, we are no more an observer now. We try to intervene. And this is what I give previously, the example of a study in single blind, double blind, or the triple blind, that I am doing an study to compare the two different therapeutic regimes for hypertension. Say, for example, one, the old drug, for example, say the methyl dopa, coming with the name of the aldamate. That's very old conventional drug for the treatment of hypertension. And now a new drug of hypertension, say any ACE or ARB. Okay. And then I have taken two groups. To one group, randomly, I assigned the old drug, and to the other group, randomly, I assigned the new drugs. But I myself don't know which the old drug is and which the new drug is. I am giving it in the name of the drug A and the drug B. And that's how I am controlling the thing. By randomizing, I myself don't know that which of the patient coming will be assigned to drug A, and which of the patient who is coming next to him will be assigned drug A or B. I have allotted the randomized number, that the number 613 will be given drug A, number 614 will be given drug B, 615 will be given drug A, and then alternatively, I don't know which patient will come on the number 613 and who will come on 614. That is how I am controlling. I am trying to exclude the bias, and I am intervening the existence of different things. And here the researcher sets the parameter or condition and is able to change them to determine their effects. Experimental research often occurs in laboratories, but can occur anywhere. The laboratories like to see, the culture and sensitivity of different drugs on different organisms, colonizing those organisms, and then looking for the sensitivity and resistance of that organisms for different drugs. And then we can do these type of the trials on animals, the effect of that drug on animals in different diseases. And then it can be done on the human beings. In fact, this is being called mostly done in the therapeutic agents. And this is called the 4 stages of the drug trials. And what are those 4 stages? In the stage 1, we do the experiments in the laboratory, and then in the stage 2, we do it on the animals, and then in the stage 3, we do it on volunteers suffering from that disease. And then in stage 4, this drug is being marketed, and we continuously observe the effects after marketing. And you have listened many times that many drugs, after marketed in the market and used for many years, they have been withdrawn due to some reason. So these are the 4 stages of the drug trials. This method of experimental research helps the researcher to understand how certain variables, the different aspects or conditions that can change, can affect whatever it is they are studying. So changing a variable can affect the results as well, and the researcher can understand through it. This type of the research is the experimental research, usually conducted to test a hypothesis. Now, hypothesis is something that we assume at the start of our study, and then we try by our data collection and analysis and interpretation to prove that hypothesis, whether it is right or wrong. For example, one hypothesis I said early in the example of the smokers and the bronchogenic carcinoma, that smokers are more, bronchogenic carcinoma is more prevalent in smokers as compared to non-smokers. This is a hypothesis. Now, I do some experiment to prove this hypothesis true or wrong. So hypotheses are of 2 types, the alternative hypothesis and the null hypothesis. Null hypotheses are usually to negate any statement. They are the negative statement. For example, I say the prevalence of bronchogenic carcinoma, there is no difference in between the prevalence of bronchogenic carcinoma in between the smokers and non-smokers. So it is negating the fact. And then I try to prove this hypothesis wrong. that there is no difference is wrong. There is difference. Okay, so if the null hypothesis is that there is no difference in the prevalence of bronchogenic carcinoma in between the smokers and non-smokers, the alternative hypothesis of this null hypothesis will be there is difference in between the prevalence of bronchogenic carcinoma in between smokers and non-smokers, and prevalence of bronchogenic carcinoma is more in smokers. So these are the null and the alternative hypothesis. So at the start of the study, we pose or we design a hypothesis, and then we took two variables, at least two variables, in which one is the independent variable and one is the dependent variable. Dependent variable is dependent on independent variable. For example, in this example, independent variable is smoking. So smoking do not depends on bronchogenic carcinoma, but the bronchogenic carcinoma depends on smoking. So if a person smokes, bronchogenic carcinoma will be more. If a person do not smoke, there are less chances of developing bronchogenic carcinoma. Then there is the severity of smoking, the frequency of smoking, how many cigarettes per day a person smokes. Is this going to make difference on this dependent variable? For example, you see the persons who are smoking more than 10 cigarettes a day, they have 90% of chances of developing bronchogenic carcinoma. This is an assumption. And the persons who do smoke less than 10 cigarettes, they have 70% of chances of developing bronchogenic carcinoma. And the persons who do not smoke, they has only 20% chance of developing bronchogenic carcinoma. So this is the dependent variable, which is dependent on this independent variable. This is the outcome most of the time. Okay, controlled experiments are also performed, and this is all another type of the study. In the experimental is the quasi-experimental, and the only difference in between the quasi-experimental study and the true experimental study is randomly assigned subjects to the group. And this randomization, I have given you the example of randomization that I had randomized the groups to be allotted the different drugs, drug A or the drug B. I said 613 will be given drug A, 614 will be given drug B. Then next, the 615 will again be given drug A and alternate. This is what the randomization is. And this is always, this is also be done in other different methods, the randomized controlled trials through the randomized table, etc. In the quasi-experimental study, randomization has not been done. If there is no randomization, then it will be, this experimental study will be called quasi-experimental. But if there is randomization, this study will be called the true experimental study. Then basic research and the applied research, we had seen that basic are the fundamental of the pure researches which are being used to increase the knowledge without knowing the application of that knowledge, without knowing the purpose or the use of that knowledge, while the applied research are usually done to find out the answer. We know the application, we know the use of that knowledge which we are going to acquire, which work we are going to do. And this usually we do to find out the answer of a question or to find out the solution of a problem. So the basic research, problem based on the researcher interest to expand understanding of the subjects. Selection of the problem is totally the choice of the researcher, and some value judgment may be made. Action is not recommended. We don't know the action most of the time. When the radium was discovered by Madame Curie, she was herself not aware of this metal and was not knowing the use of this metal. And applied research, what is the problem is an important step in the resolving. So we have a question, what is the problem? And then when we know the question, we try to find out the answer of that question, and we find to try find out the answer of solution of that problem. Researcher role is examine analytically, and a course of action is recommended by the researcher. Then there are the developmental research. Developmental research is similar to applied research, but focuses on using what is already known to improve product or existing technology. Okay, to create something new. And the example is that, for example, R&D, research and development departments are there in different institutions and different industries. And these industries continuously do the research and try to improve their products or to find out the new products to compete in the market. If a company is making some painkiller, but then other companies, other pharmaceutical companies come and they produce another painkillers which are more effective than that, then this company has to do the research and develop their painkillers to make them more effective. For example, you see, I give an example of drug diclofenac sodium that is coming with various names, the Voltron, the Warren, the Voltrol, etc., etc. This is a painkiller, but then it was observed during the stage 4 trial that this drug is causing gastric irritation or acidity. Then what the researchers did, that they they adjoined another molecule, mesoprolol, along with this diclofenac sodium. What this mesoprolol do, it takes off this medicine without interrupting, without being broken, without being absorbed or digested from the stomach into the intestine in the alkaline media. So and there the mesoprolol disintegrate and the diclofenac sodium comes out and works like analgesic. So they subsided the problem of the acidity that is being caused by this diclofenac sodium. So this is what the developmental research, that improving the products continuously to be comfortable in the market. There are different research methods and the research processes to produce new knowledge, and these processes are the exploratory research, constructive research, and the empirical research. Now let us see. Exploratory researches are those which help to identify and define the problem or the question. We want to explore the problem, what is happening, what is the problem in the community as we are trying to explore the situations of the pandemics nowadays. And then we had find out that there are mutations in the current coronavirus, and there are mutations in 9 places as compared to those viruses which are being there in China. Then there are constructive researches which test theories and propose a solution to a problem or the question. So I gave the example of the scurvy trial in 1747, that researcher